discussion around later life sexuality should become more normalised. It's something which is has been stereotyped for many years, many misconceptions, and is it really applicable for older people? So we're arguing that indeed it is. Another main recommendation would be that healthcare professionals should be more proactive in discussing the sexual healthcare of older people. So enabling them to access sexual healthcare as and when they need to. Our studies also shown, and other studies have also pointed at this, is that in the broader aspect of well-being and quality of life, sexual health and intimacy are integral parts of that. And there's growing evidence that happiness and well-being has ramifications for broader health more generally. So lower levels of chronic disease, indeed longer lifespan, indeed. So ignoring sexuality in that context, I think, is a mistake, and we need to broaden our sort of remit in terms when we think about managing more holistically the broader health and well-being of not just older people, but across all and ages as well.
I think one of the sort of unique elements of the data that we've got is we've got actual couples talking about their sexual lives. And so we've been able to look at the data and how husbands and wives or partners describe their relationships and their sexual well-being, and I think that's a particularly unique part of the study. We've found really positive things, and we've also found where couples have described the difficulties that they encounter in maintaining their sexual lives and their relationships. Some of the most striking issues that came out from the qualitative and the quantitative data were about some of the age-related changes that people were experiencing, particularly around issues with the menopause and erectile difficulties, and for men particularly how long-term conditions impacted on their erectile difficulties. And as a professor of nursing, I'm particularly passionate about how healthcare professionals respond to some of these conditions, and that long-term conditions aren't just disregarded in the context of people's sexual health and well-being.
Well, because it's one of those issues, I think, which is historically has been under-discussed, if you like. It's one of those that's been swept under the carpet somewhat. So it will be interesting to see how people feel about more open discussion and indeed discussions around problems and barriers people perceive they face in terms of dealing with their own sexual health in later life more generally, but also getting that sort of cross-generational discussion would be quite interesting as well.